Right now, high-stakes vaccine talks are underway here in Atlanta. A CDC advisory panel is meeting over 2 days to review recommendations on hepatitis B, measles, mumps, and COVID-19 vaccines. The panel itself is controversial. In June, Health and Human Services Secretary Robert F. Kennedy Jr. removed all 17 members and replaced them with 12 of his own, many who have questioned vaccine safety or mandates. 11 Alive's Marissa Sarbach joining us live now. Marissa, have those members voted on any of those recommendations yet?
Jennifer, the advisory committee just voted on new policy recommendations for the MMR-V vaccine. So what the committee is advising or recommending at this point is for the MMR to be one vaccine and for the V, the varicella, also known as chickenpox, to be a separate vaccine. They are pushing the hepatitis B vaccine vote until tomorrow.
We have a short update.
Thursday at the CDC offices in Chambly, the Advisory Committee on Immunization Practices discussed whether to change guidance on the MMR-V vaccine. Should children get one combined shot for measles, mumps, rubella, and chickenpox, or separate doses for the first round because of a slightly higher risk of seizures when given as one vaccine?
Regarding an MMR-V at 4 to 6 years of age is that, and I think you said this, that more than 95% of febrile seizures occur before 4 years of age.
Dr. Katrina Kretzinger, who retired from the CDC in 2023, says this is actually very similar to what most doctors are doing now.
The only change is that the CDC would no longer recommend using that 4-part vaccine in the 12 to 15 month age for the first dose. Whereas now, providers can choose to use the 4-part or they can choose to separate it out. And right now, 85% of providers and parents choose to already have it separated.
The advisory committee is also discussing changing the recommendation of the hepatitis B vaccine for all children to only recommending it for children whose mothers are hepatitis B positive and are at risk of passing along the disease during birth. Any recommendation changes would impact Americans in the form of their health insurance coverages, as insurance companies follow the guidance of the CDC. After the advisory committee makes their recommendations, it heads to the CDC director. He then can approve and adopt these policies before they become standard procedure. Reporting live at Roybal Campus tonight, Marissa Sarbach, 11 Alive News.
All right, Marissa, in day 2 of the advisory committee's meeting, we expect to hear their discussion and vote on the COVID-19 vaccine recommendation.